Joining me today is Alexis Watt, General Manager of Learning and Training at Royal District Nursing Services, South Australia, who is speaking at IIR's Clinical Training and Workforce Planning Summit on the 29th to 30th of August 2011 in Melbourne. Alexis, thanks very much for joining me today.
It's a pleasure.
First of all, what are the major benefits of clinical training partnerships for community nursing?
It is very important so that undergraduate students come out with a more rounded understanding of the emerging health system in Australia, and they can make choices about where they choose to practice beyond the classic locations of acute and primary health. We see an opportunity to shorten the gap also between curriculum and clinical practice, which would help improve learning outcomes for students and inform our service of opportunities to improve client outcomes as well. Almost without saying, the emerging workforce that undergraduate students represent for organisations like ours would see an opportunity to achieve their clinical performance more rapidly when they do enter our workforce, due to the fact they've had a stronger and longer clinical training experience with us on the way through their studies.
What is the partnership process that RDNS SA, Flinders University and Health Workforce Australia have actually been instigating?
What we've done is, back in the early days of the opportunity, which was about 12 months ago, Flinders University and RDNS collaborated on the funding submission. So we did quite a lot of analysis and forecasting to understand the opportunity and shape it into a competitive bid. We've applied a strong commercial contract and project management discipline to the clinical training activity on the scale that we are implementing. We've integrated the current clinical practice in the community setting, as RDNS runs it, more comprehensively with the undergraduate curriculum as delivered at Flinders Uni, both their current curriculum and the one that they're about to have re-accredited. The clinical training models that we use are undergoing an innovative growth, particularly as delivered in a clinical environment and linked to specific KPIs on their outcomes, which in the past they've not had that explicit linkage. And leaders from both organisations are on the project board, so we ensure some transparency and high levels of engagement across the two partners. And HWA is the funding source and the agency to which we have to report contract delivery. So we've got a three-way process involved there.
Can you explain the influence of funding on the process?
Funding is fundamentally what enables this project to happen. In particular, it goes some way to meeting the additional costs incurred by RDNS as a health service in hosting students. It is being applied to provide stronger clinical supervision and administrative coordination of the activity, along with dedicating specific project management expertise into the team. It's helping to drive increased student enrolments from the university's perspective, which ensures a supply of student volumes so that the training day KPIs can be met. And it's certainly influencing the timing of capital works that we're undertaking to improve the infrastructure underneath this project. The funding brings obligations attached to it, which increases the focus on commercial contract management that would otherwise possibly be a little less rigorous if the funding wasn't in fact there. So basically, without the funding, the breadth and volume of this activity simply wouldn't be possible.
What have been the key challenges from your perspective, and what are the next steps?
Mainly three key areas of challenge. One is around data, and this has probably been the single biggest challenge so far, and it includes mapping a whole range of variables such as student numbers and clinical training venues over a number of geographically diverse sites, 3 different levels of student learner, variable client acuities across our services, the skill set and attitude of existing clinical staff towards being more clinical educators than pure service delivery, the funding KPIs, the financial acquittal requirements, the timing of curriculum versus client care, and the trends we see in our service delivery across things like workforce issues, including sick leave, and the seasonality in client demand that we see for our services. The second challenge item is the terms of the funding contracts, and that's involved a fair bit of work to translate what are typically fairly generic contract terms into the clinical and healthcare environment that we operate in. And thirdly, and not least, the cultural change that the project brings. It basically represents a paradigm shift for our organisation from one where students were an exception to one where they are essentially the rule. The presence of students across all of our services will significantly increase, and clearly we have some challenges and a change process to go through to support clinical practice, practice development, maintain client outcomes and quality, and ensure the service delivery contracts for healthcare remain delivery against their standards. The next steps we're taking, quite simply finalising the funding contracts with Health Workforce Australia, commencing the capital works across 6 locations in our services, upskilling our workforce so that they can meet the education standards of the university, testing the data communications between RDNS and Flinders for things like student management and logistics, embedding an evaluation methodology into the kind of project as usual activities, so the footprint of evaluation is minimal, but we get good, rich and robust information to inform that evaluation, and finalising the documentation and reporting obligations and processes between all the 3 parties, and the role that students play in that data collection and sharing as well.
Alex, you're speaking at IIR's Clinical Training and Workforce Planning Summit on the 29th to 30th of August 2011 in Melbourne. What other key aspects will you be addressing in your presentation?
What I really want to work through with the audience on that date is the process we've gone through from the opportunity to putting this on the ground. It's very early days in that implementation, but some important learnings on the way through. Coming back again to the paradigm shift and the workforce cultural impact. What are our early discoveries about that? The way that our workforce has responded to this shift. It's been very positive, so I'd like to share some stories around that. And what do we see as the expected benefits of a project of this size and scale, both to us, to our clients, to the students, and by extension to the university.
Alexis Watt, many thanks for your time today.
It's a pleasure.